Everyone, I'm Ashley Efonye and I'll be presenting the working paper on life dissatisfaction and anxiety in COVID-19 pandemic, written by Pedraza, Guzi and Tijdens. COVID-19 has affected individuals, economies and societies. The rising numbers of COVID-19 cases, deaths, the prolonging lockdowns, the substantial restriction on public life and economic turndown may negatively affect a person's well-being and mental health. This paper builds upon existing literature of life satisfaction and will focus on 4 research objectives. The first research objective builds upon existing knowledge and explores how personal characteristics may impact an individual life dissatisfaction and anxiety. The fourth objective will study how the share of COVID-19 infected persons in the population and the measures taken by the government affect the life dissatisfaction and anxiety. They will analyze it at individual level and at country level. This to help understand through which channels COVID-19 may affect life satisfaction and anxiety. This is also interesting to look at from a policy perspective. This way they can identify individuals and groups who are mostly affected by COVID-19. Governments have adopted a range of measures to decrease the impact and the spread of COVID-19. The measures taken may have psychological and economical consequences. Other literature has shown that social distancing and self-isolation increases social isolation and loneliness. State imposed lockdowns may reduce income and have a greater economic insecurities. The paper of Professor Dr. Baert, Sir Alpoor and the ILO have shown that COVID-19 also have an impact on the world of work. This paper will try to show that a negatively change in workload and an income reduction will have an impact, will affect life satisfaction and anxiety. Next to this, the paper will also try to show that life dissatisfaction and anxiety will be positively influenced by the accumulated numbers of COVID-19 cases. We'll go further to the data and methods that are used in this paper. This paper uses the LWCV survey, otherwise known as the Wage Indicators Survey on Living and Working Condition in Coronavirus Times 2020. The questions in the surveys is about individuals, families, and the interpersonal coping with coronavirus or the COVID-19 pandemic. In total, there are 2,565 observations of 25 different countries, which each has at least 20 valid observations. These observations are taken between the 23rd of March until the 30th of April. The survey identifies 2 indicators to measure a person or an individual's well-being and mental health problems. First, they ask the question, have you recently suffered from depression or anxiety? And the second one, they used a life satisfaction question and reversed a 10-point scale to measure dissatisfaction. Also, they tested the government measures which were taking on the area of mobility restriction, the requirement to wear protective gear in public, and the national emergency measures which were taken. If you want to know more about the details of the data and methods which are used, please click on the link below of the video. Next we'll go to the results of the paper. So what did they found? They found that individuals with general better health, paid jobs, daily exercise and avoid loneliness report less dissatisfaction and anxiety. Women therefore report more than men that they have feelings of anxiety. Surprisingly, the presence of children and pets in the household has no effect on life dissatisfaction or anxiety. Anxiety does not depend on education. Dissatisfaction does. When a person, an individual, has a tertiary education, they seem to report less dissatisfaction than those that haven't. COVID-19 has impacted the working life of individuals. This paper has found that the change in working routine has people feeling more anxious and dissatisfied when their workload decreases or increases. People are sensitive to the scale of the pandemic and its consequences. The rapid spread of confirmed COVID-19 cases presented by the media increases the fear. When the COVID cases increases, so does the level of dissatisfaction and anxiety. Also, the government measures which were taken increases the human suffering, which leads to a higher level of feelings of anxiety. While this was the result of the paper, we'll now continue to the conclusion. This paper tried to explain how individuals' life dissatisfaction and anxiety are affected during the COVID-19 pandemic. We'll sum this up in 4 points. Number 1, there are a number of personal characteristics that impact an individual's life dissatisfaction and anxiety. Secondly, an individual dissatisfaction and anxiety increases when the workload increases or decreases, income reduces, and the individual reports symptoms of COVID-19. Number 3, the growing numbers of infected cases over time increases the dissatisfaction and anxiety levels. And lastly, this paper confirms previous studies that namely the state-imposed measures increases dissatisfaction and anxiety levels. At the end of the paper concludes that it's important to have a stable employment. This was my explanation of the working paper Life Dissatisfaction and Anxiety in COVID-19 pandemic. Thank you for listening and hope you gained some insight. Thank you.